Good morning. I'm Alan Braverman. On behalf of Eric Mittauer and the collaborators from the IRAD, I'll present the clinical features and outcomes of pregnancy-related acute aortic dissection. Over a 20-year interval, we surveyed the IRAD and found 29 women with pregnancy-related aortic dissection, representing 1% of women in IRAD. There were 19% of women less than 35 years old had their aortic dissection related to pregnancy. 13 were type A dissections and 16 were type B dissections, and all but one woman survived. A quarter of the patients had hypertension and a third were on beta blockers during pregnancy. 56% of women had dissection during pregnancy, with the majority in the third trimester, and 44% were postpartum, averaging about 12 and a half days. In women with type A dissection, the ascending aorta was substantially dilated at the time of dissection, whereas in women with type B dissection, the aorta was often not significantly dilated. 69% of women had an aortopathy diagnosis or a family history of aortic disease, with the majority being diagnosed with Marfan syndrome, 2 with Loeys-Dietz, 2 with bicuspid valve, and 3 with a family history of aortic disease. Half of the women were known to have a predisposing aortopathy before their dissection, but importantly, almost half were not discovered to have aortopathy until after the dissection occurred. 3 women with Marfan syndrome had aortic diameters known before dissection, and they ranged between 41 and 47 millimeters. And 2 women with syndromic aortopathy and prior valve-sparing root replacement had a type B dissection related to pregnancy. So aortic dissection related to pregnancy is a rare complication occurring in only 1% of women in the IRAD database. But among women less than 35 years old, 1 in 5 dissections occurred related to pregnancy. Type A dissections related to pregnancy are associated with a dilated ascending aorta, but type B dissections were often not related to significant descending dilatation. And aortopathy conditions are present in most women with pregnancy-related dissection, but many are not recognized until after the dissection occurred. Thank you.